Top home remedies for fever in babies. Is your baby battling a fever and you don't know what to do? Fortunately, the temperature can be brought down with some effective home remedies. Keep reading to know more. Use these simple home remedies to relieve your baby's discomfort. 1. Cold compress. Place a damp washcloth on your baby's forehead while she's asleep. This is one of the best home remedies for high fever in babies. Doing this reduces your child's body temperature and lessens discomfort. 2. Lukewarm bath. Give your baby a gentle, lukewarm bath in a tub or sponge her with warm water. This method will reduce the temperature as the water evaporates off her body. Don't bathe her in room temperature water. This can cause a rapid and drastic temperature change and aggravate the fever. 3. Fluid intake. Give your infant plenty of fluids when she's suffering from fever. Water, juice, and yogurt are good for her body. 4. Pick suitable clothing. If your child is wearing multiple layers of clothing, take off a few and let her skin breathe. Dress her in breathable fabrics like cotton and turn on the fan if required. If you are outside, however, avoid exposing her to the sunlight. 5. Onion treatment. Onion is a common and versatile ingredient of Indian home remedies for fever in babies. It helps lower body temperature and relieves body ache caused by fever. Simply cut an onion into slices and rub 2 to 3 slices on your child's feet for 2 minutes each. Do this for up to 2 times a day. Other than rubbing, onion can also be consumed. Shred and grind onion, to make a juice. Feed this juice to your baby a few times, over the day. 6. Ginger bath. Mix about 2 tablespoons of ginger powder in lukewarm water that fills your baby tub. Give your child a standard 10-minute bath in this water. The ginger helps induce sweating, which flushes out impurities. This is one of the most effective home remedies for viral fever in infants. 7. Mustard oil and garlic massage. Similar to ginger, mustard oil and garlic when combined becomes an effective agent to promote sweating and help flush toxins. To prepare this massaging agent, take 2 tablespoons of mustard oil and heat it in the microwave oven for 30 seconds. Add 1 teaspoon garlic paste to this and mix well. The heat essentially helps mix the paste into the oil. Leave the mixture for about 2 minutes as it returns to room temperature. Now, massage your baby with this mixture, giving prominence to their chest, back, neck, palms and feet. As the massage also has a relaxing effect, this treatment is ideal to do just before your baby's sleep time. 8. Egg whites. Egg whites are the protein in eggs that helps nourish the yolk. Its uniquely viscous properties makes it an effective absorber of heat, as it absorbs a high amount of thermal energy from its surroundings as it dries. Separate the yolk from the white of an egg and beat the egg white thoroughly, until it gets a smooth texture. Dip 2 small washcloths in the beaten egg whites for about a minute to get soaked. Gently wrap the soaked washcloths around your child's feet and cover them with a loose pair of socks to hold them in place. Leave this for around an hour. 9. Lemon and honey. Both lemon and honey are powerful immunity boosters. Mix some honey with lemon juice squeezed from lemon but undiluted, and half a teaspoon of ginger powder. Feed your child 1 teaspoon of this mixture twice a day. 10. Some additional tips. There are a lot of misconceptions when it comes to fever in kids. Here are some important points you need to remember while trying to manage your baby's fever. A fever comes about when the body's natural immune system is fighting foreign bodies such as viruses or bacteria that have entered it. This fighting back, by the body, causes inflammation and a rise in temperature, which is what we observe as fever. Keep in mind that contracting fevers is a natural part of the human body's development, as each time it does so, its immune system grows stronger. A fever is not an immediate sign of a serious health fault, but when the temperature goes too high or is accompanied by other symptoms, it might be. A fever in an infant below 12 weeks of age is to always be taken seriously. However, for children, who are older than 3 months, a fever that is lower than 39.5 degrees Celsius (103.5 F) doesn't require immediate medical attention unless accompanied with other symptoms. If your baby is displaying sluggishness, lethargy, vomiting, diarrhea, improper feeding etc., accompanying the high temperature, then you will need to visit your doctor. Do not resort to self-medicating your baby without consulting a pediatrician. Ibuprofen is unsafe for children below the age of 6 months as it could have harmful side effects. Studies have shown that excessive ibuprofen consumption can cause harm to the digestive system and kidneys. As a parent, it can be worrisome to see your child battling a fever. If your baby's fever refuses to subside, take him to your trusted pediatrician at the earliest.